Hi everyone, our presentation will be on pertussis, also known as whooping cough. The members of our group are Tavia Pickett, Adam Pella, and myself, Abby Polson. To begin, Adam will tell you a little bit about the etiology, reservoir, and signs and symptoms.
Hi, my name is Adam Pila. I'm part of the group that is talking about pertussis. It's also known as whooping cough, and it is a highly contagious respiratory disease. Now, it's caused by a bacteria called Bordetella pertussis, and it is the etiological agent pertussis. Now, this specific bacteria is a gram-negative coccoid bacterium. So the coccoid, it's a circular bacteria. Now it is capsulated, it's non-motile, and it does not produce spores. It does produce toxins such as pertussis toxin, fimbrial hemagglutinin, and tracheal cytotoxin. Now this specific bacteria does need oxygen because it uses aerobic respiration as its metabolism. Now it is strictly a human pathogen, and Bordetella pertussis has unusual lipopolysaccharides. And if you remember from our reading, the LPS are on the exterior of the gram-negative cell wall. Now, from the LPS, endotoxins that are produced are unlike those from other gram-negative bacteria. Now, it's different in that it contains two forms differing in its phosphate composition of the lipid portion of the LPS. Now, this form is designated lipid X instead of the usual lipid A form. The role of the unusual LPS is not fully understood in the pathogenesis of pertussis. Now, the reservoir of this particular bacteria is actually us. It cannot live on its own, and it has to have a host and thrives in optimal temperatures of 35 degrees to 37 degrees Celsius. Also, that's 95 degrees to 98.6 degrees Fahrenheit. Now, adolescent and adult humans are the reservoirs of this disease, and that's why it's so contagious to young children, especially infants. Now, some signs of Bordetella pertussis, or whooping cough, are runny nose, nasal congestion, red watery eyes, fever, and a cough. Now, these signs are very similar to the common cold, and so some people mistake that this is just a regular cold, and so they don't really think anything of it, and they just kind of let it do its thing. Now, this is known as the first stage, and it's called the catarrhal stage, and it lasts about 1 to 2 weeks. Now, some symptoms of Bordetella pertussis, or whooping cough, are thick accumulation of mucus in your airways, which causes uncontrollable coughing. Now, these attacks of severe coughing can provoke vomiting. It can result in a red or blue face, causes extreme fatigue, and the coughing may have a high-pitched whoop sound during the next breath of air, which is where the whooping cough name comes from. Now, sometimes there may be no cough or a high-pitched whoop sound, but the person affected may just struggle to breathe or even temporarily stop breathing. Now, this second stage, called the paroxysmal stage, where paroxysm can be thought of as a convulsive attack. So these coughing fits are the convulsive attack because you can't really breathe and you're constantly coughing, and so yeah.
Here is a short recap.
Hello, my name is Tavia Pickett, and we are talking about pertussis and the transmission and additional information that we may have found. The Center for Disease Control and Prevention has indicated that there could be an incubation period that is about 5 to 21 days for the pertussis. Whooping cough can spread through bacteria, which is infected droplets through a person's breath. When someone coughs or sneezes, other people can inhale their breath, and the infectious bacteria is then they may become sick. Once the coughing begins, the infection will continue for about 3 weeks.
Hi everyone, I'm Abby Polson, and I'm going to be talking about the different treatments for pertussis and also the prevention techniques. First off is the treatment for infants and young children. Pertussis is a bacteria that is rapidly progressive in children. Because of this, it is very important that treatment begins as early as possible. Many experts believe that the most effective treatment is that of antibiotics. In children, this would be azithromycin. Usually antibiotics are effective before the coughing spell begins, although they are still used and important later because they stop the spread of pertussis. Some kids with whooping cough are treated in the hospital. Babies and younger children are more likely to be hospitalized, like the baby on the left, because they have a greater risk of pneumonia. Whooping cough is life-threatening. To those 6 months and younger, treatment for them is extremely important. Next is the treatment for adults. Although the treatment is along the same lines as that of infants and young children, there are some differences. Instead of just using the drug azithromycin, with adults you can also use the antibiotics that go by the name of clarithromycin and erythromycin. Most times, patients suffering from pertussis are treated with 1 to 2 doses per day. Although antibiotics seem to be one of the most helpful treatments, those that cannot tolerate them do have other options. One such option is that of TMP-SMZ, which is an alternative agent of treatment. Overall, no matter who is treated, all choices are made upon safety, tolerability, and cost. Prevention. For many people, the most useful technique of prevention is vaccination. Vaccines have been around for many years and are recommended by the Advisory Committee on Immunization Practices. The vaccine used to prevent pertussis is called DTaP. This includes vaccines for 3 different diseases: diphtheria, tetanus, and pertussis. Although vaccines are very useful when it comes to prevention, each individual has the choice to receive them or not. Although vaccines are useful, they are not 100%. Some things we should always remember are to cover our mouth when we sneeze or cough, dispose of used tissues, and wash our hands often.
In this slide, I show a video of a little girl who was not vaccinated because she was not able to get vaccinated yet. Most children who end up with the whooping cough are sick or get whooping cough because they have not been able to get that vaccine yet. This poor little girl has a hard time breathing when she's coughing, and that is pretty much how the whooping cough or pertussis and what it can do to a child. This is one of the most highly contagious diseases out there. It is true, according to Jennifer Brown, PhD. Whooping cough, or B. pertussis, is a potentially deadly infection that's resurgent in the United States, even though it is a vaccine presentable. There has been about 28,639 just in 2013, but the problem is that most people don't report that there was any whooping cough or they did not go to the hospital. I know for me, 1 year I was really sick and I thought I just had a cold, and so I didn't go to the doctor until about 3 weeks after. I really could not breathe after coughing so much that it ended up bruising my ribs and everything. So I finally went to the doctor, and I ended up getting like 6 different medications because I had whooping cough and the flu. So whooping cough is very dangerous. As we can see in this slide, reported pertussis incidents by age groups. As you can see, the younger than 1 year old has a higher potential of becoming sick. Adults, older people that are older can also potentially get sick. Children who go to school are potentially able to get the virus because there's so many students in class that it can spread very easily. Since the 1900s, there's been an increase of pertussis in adults and adolescents, especially in infants younger than 1 year of age. And as I said before, the number of cases that have been reported are around 368 in 2015, but there are more than that are not being reported. Pregnant women must get vaccinated against pertussis because there is a chance that the child, once they are born, get pertussis. There's also a new bacteria pertussis that is in the United States called Bordetella. And this one can get into the lungs and stick to your lungs linings, and this is where the pertussis toxin is made. This can paralyze the cilia, that are the little tiny hairs that are on the lining of the lung. I found that it can also be transmitted through touching and hugging if you haven't been vaccinated and other. So it's probably a good idea to make sure to wash your hands every day after you touch people, before you touch people, especially if you work in a hospital environment.